Good afternoon, everyone. We're going to call this meeting of Health and Human Services to order. We have 3 readouts today, one from MDH Health Professional Boards and Commissions, the second one, MDH Office of Healthcare Quality, and the third is Department of Housing and Community Development. And at this time, we're going to ask Ms. Victoria Martinez to give us the readout for MDH Health Professional Boards and Commissions.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'll be going over the Health Professional Boards and Commissions. The Health Professional Boards and Commissions includes various boards that work to certify and license health professionals and to resolve customer complaints. As you can see on the first page of the analysis, the fiscal 2027 allowance increases by $4.4 million, or 9.5%, for a total of $51 million. The majority of the budget is funded through special funds that are generated through licensing fees. The fiscal 2025 portion of the budget analysis on page 2 shows that the fiscal 2025 includes a total of $6.2 million in canceled funds. Most of this is reimbursable funds in the Board of Nursing for infrastructure operations to align with the general fund appropriation in the MDH Office of the Secretary. Moving on to page 3, Exhibit 1 shows a breakdown of the agency spending for fiscal 2027, most of which supports personnel and various contract expenditures. Exhibit 2 on page 4 provides a breakdown of the allowance by board, with most spending supporting the Board of Physicians and the Board of Nursing. Exhibit 3, beginning on page 5, shows the breakdown of the $4.4 million increase from the fiscal 2026 working appropriation to the fiscal 2027 allowance. The majority of the increase is for personnel expenses. There are also changes in the Board of Physicians and Board of Nursing, in addition to various software-related changes and other shared operating costs. The Budget Reconciliation and Financing Act includes 2 board fund balance transfers, which are discussed beginning on page 7 of the analysis. They include $2 million from the Board of Physicians to the MDH Office of Population Improvement and $500,000 from the Board of Professional Counselors and Therapists to the Behavioral Health Administration. Exhibit 4 on page 8 shows the estimated special fund balance of the 2 boards and the balance as a percentage of their allowance. It is recommended that the fund balance remains at 20% of the allowance, so the boards are still left with sufficient funding after the transfers. And Exhibit 5 on page 9 shows transfers from the boards authorized in past BRFAs, with most transfers also from the Board of Professional Counselors and Therapists. In terms of personnel that's discussed beginning on page 10, there's a slight increase in regular and contractual personnel. The boards had a vacancy rate of almost 9%, which are mainly administrative positions, and Exhibit 6 on page 11 shows the change in vacant positions by board from 2024 to 2025, showing overall improvement in filling vacant positions. The first key observation, beginning on page 12 of the analysis, discusses the board's licensing activities and complaint investigations in fiscal 2025. Exhibit 7 on that page provides an overview of the new and renewal licenses issued by board. There is a new licensing requirement for assisted living managers that will begin in fiscal 2027. And Exhibit 8 on page 13 shows the increase in the estimated licenses issued by the board because of this new requirement. As shown, the number of licenses issued increases significantly, but the budget reflects only a modest increase. So DLS has asked that the board comment on whether the fiscal 2027 budget provides adequate resources to address the increase in licenses issued. Exhibit 9 on page 14 shows the complaints investigated and the complaint rate by board. This data is based on their managing for results submission, and although the Board of Nursing had the highest number of complaints investigated, the MFR data doesn't include the complaint rate for the Board of Nursing. So considering this, DLS recommends adopting narrative requesting that the complaint rate for the board be included in the annual MFR submission. The second key observation, beginning on page 15, is on the status in meeting MFR goals relating to the timely completion of issuing new and renewal licenses and investigating complaints. Exhibit 10 on page 16 shows the board's performance in meeting their MFR goals, with most boards meeting these goals with 100% timely completion. Exhibit 11 on page 17 shows the number of boards that missed each of these goals in recent years, and Exhibit 12 on the next page shows performance in meeting the timely complaint investigation, showing that there has generally been improvement in the number of boards meeting these goals. The third key observation, beginning on page 19, discusses an evaluation of the Board of Professional Counselors and Therapists that was completed by DLS's Office of Program Evaluation and Government Accountability. The evaluation reported several findings, one of which is insufficient tracking of licensing applications. Although the MFR data for the board indicates that 86% of initial applications were processed within 10 days of receipt of the last qualifying document, OPEGA found that the average time to approve initial applications was 96 days. The bulleted list on page 20 shows the steps in the licensing application process. Although the application process begins at step 1 with the applicant's initial application, the MFR measure tracks the number of days from the payment of the fee for the license, which is step 5. So the MFR doesn't reflect the entire processing time for the applicant. So DLS has asked that MDH discuss whether other boards measure this MFR in the same way to better understand how to improve the MFR measure. And lastly, OPEGA also provided several recommendations for improving the board's operations, which are listed on page 21. And DLS has asked the board to provide an update on implementing these recommendations, and also recommends adopting committee narrative requesting a report with an update on implementing the recommendations. And that concludes my presentation. I'm happy to take any questions.
Seeing no questions, if we can bring up the MDH representative, Dr. Meg Sullivan. I apologize to boards.
Good afternoon, Chair McCray and members of the Health and Human Services Subcommittee. Unfortunately, Secretary Seshamani could not be here this afternoon, so I am appearing in her place. For the record, I am Clint Hackett, Deputy Secretary with responsibility for operations at the Maryland Department of Health. Today, I'm joined by Rhonda Scott, Executive Director of the Board of Nursing, and Linda Burrell-War, Executive Director of the Board of Long-Term Care. The department thanks the Governor, the Department of Budget and Management, and the budget committees, including this subcommittee, for their support. We also thank the Department of Legislative Services, including budget analyst Victoria Martinez, for the insightful and thorough budget analysis, as well as for the recommendation to concur with the Governor's allowance. As a reminder, with the exception of the Board of Nursing, the health professional boards and commission operate independently of the Department of Health. The department does, however, provide operational support, primarily in the areas of human resources, fiscal services, and procurement. In the DLS analysis, the MDH health professional boards and commissions was asked to respond to 4 items. While representatives from 2 of the boards of focus, well, I would say 1 of the board of focus, the Board of Professional Counselors and Therapists, could not be here today, MDH will provide responses on their behalf for the record. So firstly, the State Board of Long-Term Care Administrators was asked to provide any updated estimates of the number of licenses for assisted living managers in fiscal 2027, a description of the board's implementation plan for addressing the increase in licenses, the positions needed to increase the licensing activities, and a discussion of whether the fiscal 2027 allowances provided adequate resources to implement the expansion of licensing activities. So in response, the board notes that the estimated number of licenses to be issued by the State Board of Long-Term Care Administrations to assisted living managers in fiscal 2027 is 1,628. This estimate is based on data from Office of Healthcare Quality's Directory of Assisted Living Programs currently licensed in Maryland. As a result of House Bill 874, State Board of Long-Term Care Administrators requirements for assisted living managers, the licensing requirement was extended from October 1st, 2024 to July 1st, 2026. As required by Chapter 785 and 786 of the Maryland Acts of 2024, the board is required to submit reports to the House Health of Government Operations Committee and the Senate Finance Committee regarding its preparedness to license and regulate assisted living managers. Reports are due on or before October 1st, 2024, October 1st, 2025, and October 1st, 2026. The required reports must address the board's readiness to implement assisted living manager licensure by July 1st, 2026 in the following 6 areas: the dates by which the board intends to begin receiving applications and issuing licenses to ALMs, the status of appointing ALM members to the board, staffing levels including the number of personnel employed and the status of filling vacant positions necessary to implement ALM licensure requirements, the capability of the board's software platform to accept applications and issue licenses, including timelines for any necessary information technology enhancements. The timeframe and steps taken are to be taken to inform assisted living programs and ALMs of the new licensure requirements. And finally, any additional policies the board anticipates adopting to implement ALM licensure requirements. The board submitted reports on October 1st, 2024 and October 1st, 2025, providing updates across the 6 areas. The most recent updates relevant to the anticipated increase in licensure volume are summarized. Firstly, on application processing platform, the board will utilize its existing online licensure platform to process ALM applications. The initial application portal for ALM is anticipated to go live on April 15th, 2026. This platform has been used successfully for nursing home administrator licensure since September 16th, 2024. The system incorporates a Smartsheet-based document upload function supporting the board's transition completed in February 2025 to a fully electronic paperless process for receiving, storing, and managing application materials. As it pertains to application requirements and processing efficiency, under newly adopted regulations, the estimated 1,628 individuals who have practiced as assisted living managers in a licensed assisted living program in the state prior to July 1st, 2026, will be permitted to attest within the online application to meeting all licensure requirements, qualifications, trainings, and certification standard, except for one specified requirement. The attestation process is expected to significantly expedite staff review and license issuance. As it pertains to notifications and timeframes, to promote transparency and to ensure timely awareness of licensing requirements, the board sent notifications to ALMs on October 28, 2025 and February 2nd, 2026, providing updates on the status of the assisted living licensing requirement. The most recent communication advised that licensing requirements would be posted on the board's website on February 13th, 2026. And finally, as it pertains to staffing levels and resources, the board's fiscal 2027 budget includes 5 regular staffing positions which aligns with the operational demands associated with the increased licensing activity resulting from the new assisted living manager licensure requirement effective July 1st, 2026. In 2023, the previous executive director submitted an over-the-target request for 3 mission-critical positions in response to legislation that became effective October 1st, 2022, which originally established an ALM licensure implementation date of October 1st, 2024. These positions were approved in fiscal year 2025, and the associated appropriations are incorporated into the fiscal year 2026 and 2027 budgets. Moving along to the second item, the Board of Nursing was asked to comment on the DLS recommendation that considering the board received and conducted the highest number of complaint investigations, but the managing for results data did not report the complaint rate, the board should adopt committee narrative to request the Maryland Department of Health include the total licenses and complaint rate for Board of Nursing in the annual MFR submission. In response, the Board of Nursing does concur with this recommendation to include nursing and total licenses and the complaint rate data reported to DLS through the annual MFR submission. Moving along to the third item that we were asked to comment on, MDH was asked to discuss whether other boards consider the receipt of the licensure fee as the last qualifying document for measuring timeliness of application processing from receipt of the last qualifying document as reported in annual MFR submissions. Our response included a couple of examples. We noted that the Board of Physicians, for example, has online applications for most practitioner types. Applicants pay an application fee, and once the application has been approved, the applicant logs in, pays a licensure fee, and can download their license. As an example, from January 1st, 2025 to February 16, 2026, the board received 1,832 applications for physician initial licensure. The average time from the first payment to the approval for licensure was 10 days, and the average time from first payment to license is 13 days. So there was a 3-day sort of like, gap between when they actually got the license approved and when they were able to go into the system and download the actual artifact demonstrating that they were licensed. The licensure and certification fee for the Maryland Board of Nursing is one prerequisite for the issuance of any licensure or certification. Once the fee is paid and the application is submitted, staff must review the application to verify that all minimum requirements, including additional required documents, are satisfied. For the rest of the health occupation boards, there are either separate application and license fees or a combined fee. For boards that require both an application fee and a license fee, the license fee is the last qualifying document before issuing a license. For boards that have a combined application licensure fee, the fee is not the last qualifying document before a license is issued. So there's sort of a mix in the state of affairs. In the analysis, we sort of broke it out between those that have the application fees only, and then those that have a mix of the application and licensure fee. So acupuncture, audiologists, morticians, optometry, pharmacy, physical therapy, psychologists, and residential childcare are examples of those that just have the application fee. And then the kidney disease, dietetic practice, podiatric, long-term care, chiropractic, massage therapy, dental, social work, and environment health are examples of those boards that operate like physicians, where they have the application and the licensure fee, and then the licensure fee is the last document before license. The fourth item that we were asked to comment on, essentially, and I believe this is the final item that we were asked to comment on, had to do with update to the committee on activities and a timeline for implementing the Office of Program Evaluation and Government Accountability, OPEGA's recommendations. To continue monitoring progress in improving the board's operations, DLS recommends adopting the committee narrative to request that MDH, in collaboration with the Board of Professional Counselors and Therapists, submit a report with an update on activities to implement the recommendation in the OPEGA evaluation. So responses here from the board is that since the issuance of the report, the board has taken proactive steps to strengthen its workforce capacity and to reduce operational strain. Firstly, through active recruitment efforts, the board has worked in coordination with the Maryland Department of Health's Office of Human Resources to initiate recruitment for vacant positions and to prioritize critical roles necessary to maintain licensing, complaint processing, and compliance function. The board is still actively recruiting since some staff took advantage of the state's early retirement program and there were other staff resignations. Secondly, they are assessing contractual positions. The board has conducted an internal review of contractual PINs to determine feasibility for conversion to merit status. This review was guided by workload sustainability, turnover patterns, and long-term operational needs. Advocacy for merit conversions. Consistent with OPEGA's recommendations, the board has formally supported the conversion of select contractual positions to merit positions to provide workforce stability, to improve retention, and to reduce disruption in essential regulatory functions. With the assistance of the department's HR department, the Board of Professional Counselors and Therapists was able to convert contractual employees into merit PINs for 2 contractual employees. Then there's the exploration of shared human resources support. The board has engaged in discussions regarding shared HR liaison services to streamline recruitment timelines, to reduce hiring delays, and to improve onboarding efficiency. Working with the HR liaison since the evaluation has been a much smoother process. And finally, workload monitoring. The board continues to evaluate staffing levels against increasing licensing volume and investigative caseloads to ensure alignment with statutory obligations. So it is with immense gratitude that I thank the subcommittee for your time and consideration today. We are happy to take questions at this time. Again, since our partners from the Board of Long-Term Care Administrators weren't able to attend today, we'll take specific questions. I'm sorry, yes. Board of Professional Counselors and Therapists were not able to attend today. We'll take specific questions for that board and commit to providing an expeditious response to the subcommittee.
Some quick questions. In reference to the long-term care administrators, obviously Ms. Martinez recognizes that it jumps up 332%. You have stated that 5 staff members. Do you think that that's sufficient? And if so, like what type of modeling did you do to get to that 5 folks for that 332% jump?
And this is the Board of Long-Term Care?
Yes, sir.
Okay, I will take that question back.
I can answer.
Yeah, go ahead.
It's on, okay. Good afternoon. Thank you. The previous executive director, and it was mentioned in the report, put through a target, over the target request, and it was actually based on 4,000 assisted living managers at the time for an additional 3 staff, so that we would have a total of 5 operational staff. So it's more than sufficient because we're not going to be licensing the alternate assisted living managers, only assisted living managers, so it's reduced that total to about half.
Okay.
So it's already in the budget. What happened was we got the extension to July 1st, 2026. So that's why you see the number of licenses at 490 and this significantly jumping. And it looks as if we're not adequately prepared, but we have not had 5 people working on licenses at this time. I'm currently hiring for the 4th operational person. The 5th person would be the investigator.
Okay, so what I'm hearing is that MDH feels as though it's sufficient.
Yes.
Okay. In reference to the second question, I think that OPEGA had made some level of acknowledgments in reference to, and you discussed it a little bit, but you didn't unpack it. The receipt at the pay or when the payment is there in reference to like the timeline, but they also, questioned or wanted to acknowledge, like, first, are you guys going to bring this in the uniform and get everybody to do that? But second, like, how are you all tracking the folks that are in that bubble, may not have paid yet, but still trying to figure out the conversation? Like, that's where the hang up from reading this sounds like it is with OPEGA.
Yeah, I will just say that, yes, there's an acknowledgement that the current measurement is inconsistent because of those two different categories. And what I am trying to do as I go forward is to have conversations with the boards to figure out like what's the best way to make sense to be able to be consistent. So it may be that we have to do something, have a specific measurement for those boards that have the application and the licensure. That might be one measurement. And we may have to kind of figure out a consistent measurement for their other categories of boards. But I want to have conversations, and one of the things that I am doing this calendar year is I'm personally going out and talking to each of the board directors and learning more about their operations. So I think this is something that I would like to gain their input on in terms of what they believe would make more sense for that consistent measurement for that second category. And I think once we have that, we can make an adjustment to get to that consistency.
Are we currently tracking from when they had that first conversation to when that payment is making? Is MDH tracking that?
I'll have to follow up on that. I'm not sure if we're consistently doing that for all of the boards.
Okay, because it sounds like you guys are doing great with the 10-day turnaround and things of that nature, but that's where the hang-up is, at least what Mike was saying.
I will take that back.
Yep. The last question, in reference to the $15 million over the 5 years in reference to fund transfers with the boards, obviously you have one that's coming through BRFA at this moment. I think it's $2.5 million. Like, can you speak to how that then impacts maybe staffing? I know technology has been some of the challenges with some of the boards, but the maintenance, like what they have going on as we consistently do these fund transfers over the last several years.
Okay. I do not have a response on that. What I would tell you, I can speak specifically to technology. We do have, as I think you're aware, we do have a major IT development project in the works right now, where we're trying our best. It's not going to be all of the boards on board, but we're using that funding to be able to, and I just met with the directors this morning on this topic. We're using the funding that's coming through the MITDP to be able to set up a new system that all of the boards, as many of the boards I would say, because some of the boards have their own newer systems, but as many of the boards as possible that can come in. And of interest, with this consolidated system, I'm expecting that we should be able to see some cost savings for the boards, because the department's going to commit to basically doing the maintenance of that system. So they won't have to pay a vendor for that going forward. What they will have to invest in is licenses for this new system, which I anticipate will be lower. So from the technology lane, we are trying to make things more efficient, trying to realize cost savings. I will have to follow up with you in terms of how the additional funding, that transfer, is impacting the human resources side of things, and I can get back to you on that.
I appreciate that, and if you can get back to Ms. Martinez, that would be helpful. That's all my questions. Senator Zucker.
Thank you very much, Mr. Chairman. For the Enterprise Licensing and Regulatory Management Solutions Project, I know this is a license management system. There have been concerns raised in the past about the scalability and efficiency, and the scalability and how that would impact or not impact the other 22 boards and commissions in terms of their being able to have accessibility into it and utilize it. Do you have any comments on that?
Absolutely. So the intent of that enterprise licensing and regulatory management system is really to encompass as many boards as possible. So right now we're building it out specifically for the Board of Nursing. This morning I met with all of the executive directors, and I encouraged them, we're not going to force folks, but encourage folks, welcome folks to join the platform. The more of the boards that can leverage the system, the more that we can do bulk purchasing of licensing to bring down the cost. So the intent is as many boards as possible, we are opening the gates. I know that there was a request for proposal, an RFP, that was done a couple of years ago by a number of boards that came together. Those boards have a very strong interest in joining the ELRMS platform. So what we committed to this morning was to sort of gain and get a list of all the boards who would be interested, get a list of the number of people in their boards, and get a list of the number of their populations, like how many licensees that they have. We're gonna basically pull that all together and come up with estimates so the boards know what their pricing will be going forward. I will say in closing, even if boards don't join us, I would still want to encourage the boards to sort of like feed their data into our system so that we can look holistically across the state of Maryland and get a good sense of where we are in terms of licensure from a state perspective.
Thank you, Senator Zucker, and I just want to say thank you, Mr. Deputy Secretary. I remember earlier conversations during the interim in reference to some of the challenges, speaking with you and Madam Director about the nursing board and how we're righting that ship from that standpoint. So I just want to say, and you also talked about technology and trying to figure out how do we look at what does alignment look like. If we can get Ms. Martinez the requests that have been asked for, that would be very helpful. Also want to say, Ms. Martinez, obviously, we'll see you at the next one, but just want to say thank you for letting us see it a little bit more clear. Did you have a question, Senator Hockley? Seeing no further questions, we'll move on to the next agency. The next agency will be the Maryland Department of Health, Office of Healthcare Quality.
Thank you.
Thank you, Mr. Chair and members of the committee. My name is Victoria, and I'll be presenting on the Office of Healthcare Quality Budget Analysis. The office licenses and certifies several types of healthcare programs and facilities for compliance with state and federal standards. As shown on the first page of the analysis, the fiscal 2027 allowance increases by $1.5 million or 3.6% for a total of $43.8 million. On the next page, there's a discussion of a special fund increase of $2.7 million from the state civil money penalty fees special fund to support their contract for nurse surveyors used to resolve a case backlog in the long-term care unit. However, it's unclear why the availability of these funds increases, so DLS has asked that MDH comment on whether the fund has sufficient balance to support this spending. There's also one proposed deficiency that adds $1.4 million for personnel due to support a shortfall due to lower than expected vacancy savings. Exhibit 1 on page 3 shows a breakdown of the fiscal 2027 allowance. About 87% of the agency's spending is for personnel, but there's also $4 million in the long-term care unit that mostly supports the nurse surveyor contract. Exhibit 2 on page 4 shows personnel spending by monitoring unit, with the largest portions being in the long-term care unit and the developmental disabilities unit. Exhibit 3 on page 5 shows a breakdown of the $1.5 million increase from the fiscal 2026 working appropriation to the fiscal 2027 allowance. The largest increases are for personnel expenses, mainly due to increasing costs of healthcare. There are smaller changes relating to nurse surveyor positions and other operating or administrative changes. In terms of personnel that's discussed beginning on page 6 of the analysis, there is no change in regular positions, but an increase in one contractual position. The office has a vacancy rate of 8% with 22 vacant positions. And Exhibit 4 on page 7 shows a breakdown of the vacant positions by program and position type, with most vacant positions being nurse surveyor positions. Exhibit 5 on page 8 shows the change in vacant positions by program from 2024 to 2025, showing an increase of 6 vacant positions in 2025. In considering the increase in the vacancy rate, DLS has asked that the office comment on challenges in filling nurse surveyor positions and to discuss recruitment efforts. The first key observation, beginning on page 9 of the analysis, discusses the office's mandated survey activities and progress in meeting their goal of surveying all providers annually. Exhibit 6 on the same page shows the annual survey rates in the developmental disabilities unit. Exhibit 7 on the next page shows the assisted living unit annual survey rates, and Exhibit 8 on page 11 shows the long-term care unit annual survey rates. As shown, all programs increased their annual survey rate in fiscal 2025, showing improvement in meeting their survey goal. The next key observation discusses significant improvements in resolving the annual survey and complaint investigations backlog in the long-term care program. Exhibit 9 on page 12 shows the annual survey backlog with 172 overdue surveys in December 2023, but as of January 2026, they only have 12 overdue surveys. Exhibit 10 on page 13 shows the complaint investigations completed, with an increase in the number of complaint investigations completed in fiscal 2025. And this progress is mainly due to their contract for nurse surveyors to help resolve this backlog. So DLS has asked that the office provide an update on the timeline for fully resolving the complaint backlog and the plan for the long-term use of the subcontractor nurse surveyors. And the last key observation, beginning on page 14, discusses a change in nursing home survey activities for Montgomery County. The BRFA of last year included a provision that authorizes Montgomery County to request and accordingly requires MDH to delegate authority for the county to conduct nursing home surveys and inspections if MDH failed to comply with certain requirements. The office reported that it has sent an MOU to Montgomery County for nursing home surveys and inspections. So DLS has asked that they provide more details on the MOU, including the responsibilities delegated to the county and the associated cost. And lastly, DLS's recommendation is to concur with the governor's allowance. And that concludes my presentation, and I'm happy to take any questions.
Seeing no questions at this time, if we can bring up the agency. Dr. Sutherland and Madam Chief of Staff.
Thank you so much, Chair McCray and members of the committee. For the record, my name is Dr. Meg Sullivan. I serve as the Deputy Secretary for Public Health Services at the Maryland Department of Health, and I am happy to be here today to talk about the Office of Healthcare Quality, which, just as a very brief overview, is the agency within the Maryland Department of Health that determines compliance with state requirements and/or federal certification requirements. Currently, we license over 23,000 providers in 47 industries and have seen a 21% growth rate in the total number of licensed providers over the past 5 years. So I think was evidenced by the analysis. OHCQ has taken numerous steps to strengthen our facility oversight functions, including through staffing, addressing backlogs and inspections, strengthening our training and quality assurance, and developing operational efficiencies. I think we can say we have made tremendous progress, but also know that we still have a lot of work to do and look forward to partnering with you. I'm going to just briefly go over our written testimony, and then we are more than happy to answer questions. As always, I would like to start off by thanking the Governor, the Department of Budget and Management, and the Budget Committee for their support, and of course, thanking the Department of Legislative Services for insightful budget analysis and for concurring with the recommendation. First, we were asked to explain why special fund availability from the State Civil Money Penalty Fees Fund increases in fiscal year 27 allowance, and discuss how the funding will be spent, including whether the fund has sufficient balance to support the $2.7 million for the nurse surveyor contract and the long-term care unit, and whether the purpose of the spending is an allowable use of the fund. So the special fund increase in FY27 from state civil money penalty fees is to address costs associated with long-term care contractual labor. The special fund balance for the State Civil Money Penalty Reinvestment Fund is currently $2,586,336 as of January 31st of this year. While this revenue source is variable, we believe there will be enough revenue attainment by the end of FY27 to support expenditures. If revenue attainment falls below budgeted levels for this contract, then OHCQ will adjust the scope of work accordingly. And we will confirm that the contract's activities are an allowable use of the State Civil Money Penalty Reinvestment Fund. Next, we are asked to comment on the challenges in filling nurse surveyor positions and discuss recruitment and retention efforts. I will say we fully recognize that recruiting and retaining qualified nurse surveyors remains one of the key operational challenges affecting survey timeliness, particularly in the long-term care field. While survey positions have been exempted from the state hiring freeze and OHCQ continues to actively recruit, the market for experienced certified nurse surveyors remains highly competitive due to post-pandemic workforce shortages and salary competition from hospitals, from the private sector, and travel nursing. And despite these challenges, though, OHCQ has made measurable progress in strengthening staffing capacity. Since July 1st of 2023, we have hired 39 new long-term care surveyors, and 2 additional surveyors are currently in training. Our overall vacancy rate has improved from 22.9% on July 31st of 2022 to 7.3% as of January 31st of this year. The vacancy rate for nurse surveyor positions is 7% as of January 31st, 2026. We continue to address these challenges through focused recruitment and retention strategies, including accelerated hiring for exempt surveyor roles, structured onboarding and training pathways to build certification and competency, targeted outreach to qualified nurse candidates, and retention efforts that emphasize professional development, certification support, and workload management to sustain capacity and maintain survey performance. Next, we are asked to provide an update on the status of and timeline for resolving the complaint investigation backlog and comment on the plan for use of subcontract nurse surveyors and funding sustainability for the contract in the future, as well as to discuss full-time state employee and subcontractor nurse surveyor staffing needs to continue ensuring timely complaint investigations. So we previously projected that the complaint investigation backlog could be resolved within 2 years within the support of the subcontractor nurse surveyors. And since implementation of October 2024, we have used the subcontractor nurse surveyors to increase investigative capacity and improve timeliness for complaint closures while reducing age cases. While significant progress has been made, the backlog has not yet been fully eliminated, and we continue to rely on this contract to maintain substantial compliance with complaint investigation requirements while completing the remaining backlog. The current estimate is that the complaint backlog can be fully resolved by October 2026 or within approximately 2 years of the contract operation start, of course, depending on the complaint intake volume and the number of high-priority investigations that require extended timeframes. The fiscal year 27 allowance remains necessary to avoid a loss of investigative capacity before the backlog is fully resolved and to sustain timely complaint investigations to prevent a new backlog from forming. And then finally, we are asked to comment on the details of the MOU with Montgomery County, including the responsibilities delegated to Montgomery County, the start date and length of delegated authority, and costs associated with conducting surveys and complaint investigations, including the breakdown between state and county funding. So we will say Montgomery County has formally requested delegation of authority under the BRFA provision. MDH and Montgomery County are currently negotiating the MOU language that would govern the scope and terms of any delegated survey and complaint investigations, and in fact have a meeting tomorrow to further continue those conversations. And that completes our written testimony, and we are happy to answer any questions.
Thank you, Dr. Sullivan. Some quick questions. In reference to, you said that we'll adjust accordingly if the fund doesn't hit the target number that you need. Like, can you speak to what does that, how do you define that? Do you get rid of some inspectors, like less inspections, the nurse surveyors, like unpack that a little bit? Yeah,
and I think, I think you're talking about, right, the state civil money penalties for the, contracting surveyors. I mean, I think this, obviously, all of OHCQ remains such a dynamic workload, right? Because we don't know how many complaints we're going to receive and the number of priorities. And so it's something that we monitor very closely. We'll say as we look at if we were to exceed that number, we would look at what our expenditures are in other settings, whether it is through our vacancies, right, our staffing spending. To your point, look across other divisions and see where efficiencies can be done as well.
Around the timeline around the contractors, the nurse surveyors that was hit, obviously it's a little bit heavier than what we had projected. Can you speak to like how you say that you gave a date? I appreciate the goal that we put forward. That's important. So what measures are we putting in place? Let's say if we do hit our date, we don't hit our date, but making sure that we're just not contractor dependent. Obviously, it's getting a little bit.
Yeah, and I think that's something that we take very seriously as well. I think we are looking at two things. So first, to your point about the measures, I mean, we're monitoring on a regular, pretty much daily basis what our complaint backlog is and how we are making progress, and I think have heard the significant progress that we're making. I think the second thing is looking at what our steady state of staffing will need to not only continue or completely eliminate the backlog, but then continue to avoid any backlogs going forward. We talked about how many staff positions we have added, how we are working to keep our vacancy rate low and continuing to prioritize recruitment and retention efforts to ensure that we are, again, to your point, we want to find that new steady state and not be reliant on contractors.
And then the last question, I know you're in MOU negotiations with MOCO, you said as early as tomorrow. So if you can just keep us, especially while we're in session, keep us abreast of how that conversation goes. Want to make sure, obviously, this is a function of the state. I know that is the same. I believe that we're in alignment with that. And also speak to, like, while MOCO's asking now, how do we know another jurisdiction isn't asking tomorrow?
Yeah, and I think that is something, I think we appreciate the collaborative conversations since I've been in this role that we've had with Montgomery County, right? We have a draft statement of work with them. Again, look forward to the conversation tomorrow as we're trying to balance what you talked about, right, with meeting their needs. I think to your point around looking at what does this mean for other jurisdictions as well, I think this just continues to be an ongoing conversation, both with Montgomery County and more broadly as we see what happens.
Senator Augustine.
Thank you, Mr. Chair. Congratulations on working down the backlog. I mean, I know that it was just really a lot of effort. Where can one find the results of these surveys and findings?
So I think first what gets at your question is we've been, and I know what we talked about specifically here is the number of surveys. And when we look at the backlog and we look at annual surveys, you know, across nursing homes and assisted living have made significant progress. But it's not just about the numbers. It's also about, right, what the quality of the surveys to ensure that we're not sacrificing those. And then what the outcomes we're finding and that we're making sure that corrective action is taken. I know that it differs to your question about between nursing homes and assisted living, where things are posted, what is publicly available. I'm happy to follow up to give you kind of the specific answers, depending on which type you're looking for, about where we can find things that are publicly where the results are publicly available. I also know we're working on our website to make sure that there are links to, and I am blanking, it is Compare. There's a couple of websites where a public can go to find certain information about facilities, particularly if they're looking for loved ones.
Yeah, I mean, that's the thing. I'm on your website and it's not there. There's no way to sort of get to, as a public, to find, you know, what you guys are not doing. It's just not here. And so I would appreciate if we could get back, like, where folks can find that information. I also it's great that it's down, but there are for me, questions about, well, what was the quality of the work that was done in getting it down? I still get a significant number of complaints about these healthcare facilities. And so I just really would want to make sure that while we're getting that number down, that we're doing it in a way that we're also just going to get some better health outcomes for our Marylanders.
Yeah, I think, and we share the priority, as you said, in getting it on the website. We'll make sure to follow up shortly.
And seeing no further questions, just want to lean in and thank you, Dr. Sullivan. Thank you, Madam Chief of Staff, for the work that you all are doing. Obviously, the MOU, some of the things that we asked to come back to Ms. Martinez that would be helpful. And Ms. Martinez, this is the final one that we'll see you today. And let me be clear, you helped us see the board a lot more clear in reference to the strengths and weaknesses of the agencies. Colleagues, this is going to be our last one coming up, the Department of Housing and Community Development. And we're going to ask for Ms. Emily Haskell to do the agency readout.
Thank you, Mr. Chair. Again, I'm Emily Haskell, and I'm presenting the operating budget analysis for the Department of Housing and Community Development. Start right on the page 1. As you can see, DHCD's operating budget increases by nearly 30% in fiscal 2027 to $729 million. The increases are across basically all fund sources. Federal funds are up 30% for rental subsidies. Special funds increase about 40% for DHCD's energy programs, and general funds are also up 7%, with new funding for a permanent supportive housing initiative and new funding for grants to Montgomery County facade programs, offset by the ending mandate for the greenhouse gas reduction initiative. I'll get into more details on all of those later, but I'll jump now to the top of page 6 to talk about federal rescissions for broadband. In May, the federal government announced the cancellation of digital equity programs funded under the Infrastructure Investment and Jobs Act. Maryland was originally expected to get $13.4 million from the State Digital Equity Capacity Grant Program. Although this funding is no longer available, DHCD is still spending down the $82 million in federal American Rescue Plan Act funds that were allocated in the operating budget for broadband, including service and device subsidies. However, the expenditure deadline for those funds is December 2026, and there's no continued funding for digital equity included in the agency's budget. As of this past December, there was still $5.1 million unexpended from those ARPA funds that DHCD is still working on spending down, but they anticipate that all funds will be expended by the deadline. On page 7, Exhibit 2 shows an overview of the fiscal 2027 allowance. You'll see rental services programs make up the largest share of the budget. That's mostly the federal rental subsidies. And I also want to point out this exhibit reflects DHCD's reorganization, notably Homeless Solutions. That division is pulled out for the first time. It used to fall under neighborhood revitalization. It accounts for 7% of DHCD's allowance at $48 million. Turning to the top of page 10, I want to talk briefly about the Budget Reconciliation and Financing Act. There's one provision in the BRFA related to DHCD that would expand the eligible uses of the Strategic Energy Investment Fund to cover programs and initiatives related to state climate change mitigation and resiliency. The allowance for DHCD includes a fund swap contingent on this provision, basically replacing general funds with CEF funds for existing personnel positions in the energy programs. And DLS is recommending just a technical language added to the contingency language in the budget bill to more closely align it with the applicable BRFA provision. On the bottom of that page, this begins the discussion of federal rental assistance, which increases by 34% in fiscal 2027. The largest component of that is the Housing Assistance Payments Program, which is project-based rental assistance that DHCD administers statewide. That accounts for $384 million in fiscal 2027. There's also the Housing Choice Voucher Program as another component of that, which DHCD administers for the rural portions of the state. Exhibit 4 on page 11 shows the increases in Housing Assistance Program subsidies over time. I'll point out one of the main reasons for this increase, it's not due to serving additional households, it's primarily due to increases in rental and utility costs. So you'll see that in Exhibit 4 as well. It shows the fair market rent for the DC and Baltimore metro areas set by HUD. On the bottom of page 11 onto page 12, this discusses the Montgomery County facade program. DHCD's allowance includes a new $3 million in general funds to support Montgomery County's facade refresh grant program. That's an existing county program that helps businesses upgrade their storefronts. The county has allocated $3.5 million to its facade program since fiscal 2022, including $1.5 million anticipated for fiscal 2027. The program has supported 30 businesses so far, with an additional 25 in progress. State funding would support a further 100 businesses, and so DLS has asked the department to comment on the county's capacity to implement a much larger program. The program is available for businesses countywide, although the county estimates about half of the funding is expected to serve businesses within a half mile of Purple Line stations. I'll note the capital budget for DHCD also includes $5 million in general obligation bonds to fund local facade improvement programs, including a proposed award for Montgomery County of $600,000 for their countywide facade improvement program, which is similar to the refresh program but covers larger improvement projects. So the combined state funding of $3.6 million in fiscal 2027 exceeds Montgomery County's $3.5 million that have been allocated since the start of these facade improvement programs in 2022. DLS recommends reducing the general funds to support the Montgomery County facade program by $2.5 million, and this funding can be fully or partially replaced with general obligation bonds. This recommendation would leave some funding in place for non-bond eligible costs, as DHCD has indicated. Funding may also support Montgomery County's operating costs. I'll turn ahead again to issue 1 of the analysis, beginning on page 15. This discusses the Division of Homeless Solutions, which, as I mentioned, has funding totaling $48 million in fiscal 2027. This includes general funds of $25.5 million, comprised of $14 million for grants to local continuums of care, $5 million for the Community School Families Rental Assistance Program, and $5 million for a new permanent supportive housing initiative. Permanent supportive housing refers to permanent housing that pairs long-term rental subsidies with voluntary supportive services, and it's targeted toward individuals who have experienced chronic homelessness. The new initiative is intended to complement DHCD's recent efforts to support permanent supportive housing through preferences in awarding federal low-income housing tax credits. DHCD estimates the program will serve about 200 households. That represents approximately $25,000 per household. And DHCD plans to award the funds to local community-based providers who will administer the subsidies and also provide wraparound services. Turning to the second issue in the analysis, on page 20, Exhibit 9 shows the major components of DHCD's energy programs. Overall, funding for DHCD's energy programs increases 46% in fiscal 2027. The largest component of DHCD's energy programs is the Empower program, which is funded through an assessment on ratepayers and helps low-income households undertake energy conservation projects. Funding for Empower has been increasing over the past several years to meet the goals set out in statute to reduce greenhouse gas emissions below specified levels. Empower grants and contracts increased by $27 million in DHCD's operating budget to a total of $81 million in fiscal 2027. The fiscal 2027 allowance also includes $22 million for the first time in CEF funds in DHCD's energy programs. That will support 3 programs. The first is $10 million for the low and moderate income multifamily building electrification program. This program is sort of the successor to the greenhouse gas reduction initiative. That was mandated at $5 million from fiscal 24 to 26 in Climate Solutions Now, and the mandate is ending. There's also $10 million in CEF funds for the multifamily solar program to fund solar and battery installation projects, and $2 million to fund charging infrastructure at multifamily properties. Finally, on page 22, this shows the DLS recommendations. First, the reduction in funds for the Montgomery County facade program, and the 2 technical language corrections for the BRFA. And that concludes my presentation. I'd be happy to answer any questions.
Thank you. Seeing no questions at this time, if we can bring up Secretary D.
Good afternoon, Chair, Vice Chair, members of the committee. For the record, my name is Julia Glanz. I serve as the Deputy Secretary for the Maryland Department of Housing and Community Development, and it's my pleasure to be here with you today. Our secretary got stuck in some flight cancellations with the storm and sends his regards. Also joining me at the table today is our Deputy Director of our Division of Finance and Administration, Isabel Trujillo. So happy to get into it with you all. So Maryland continues to navigate a challenging fiscal environment shaped by the wind down of one-time federal COVID relief funds that mask longstanding structural pressures and continued uncertainty at the federal level that has potential to impact housing, infrastructure, and economic stability. In response, the Moore-Miller administration has advanced a common sense, fiscally disciplined budget that prioritizes long-term growth while responsibly managing limited resources. In partnership with the administration and the General Assembly, DHCD has remained focused on making Maryland more affordable while operating within clear fiscal guardrails. Fiscal discipline is not new for DHCD. Over the last 12 months, our senior leadership team launched a major update to the way we make money to pay our bills with increased revenue from fees and investments. This should keep our fiscal outlook strong, but we also work to identify cost savings in a way that protects our core mission, maintains operational continuity, and avoids negative credit impacts. We're working across our divisions to identify efficiencies, reduce avoidable costs, and find creative solutions that preserve our ability to deliver for Marylanders. Those actions position DHCD to enter FY27 with lean, efficient operating posture while continuing to deliver results. DHCD's FY27 operating budget requests total $729 million. General funds total $45.8 million, representing only about 6% of the department's overall budget. And most of that funding flows back into communities as program awards, driving local economic activity and impact. Less than $2 million of our general funds goes towards administrative costs for the department. The majority of the budget supports operating program grants and loans that leverage private capital, recycle funds over time, and maximize economic return. Even as the federal landscape continues to shift, DHCD has maintained strong fiscal performance and accountability. In fiscal year 2025, DHCD generated $8.5 billion in total economic impact statewide. Every state dollar invested leveraged nearly $16 in private and federal investment. These investments supported more than 30,000 full-time equivalent jobs and generated significant state and local tax revenue. The FY27 operating budget reflects disciplined fiscal management and targeted investment in community impact. On the DLS recommendation to reduce the $3 million for the Montgomery County Facade Refresh Program, the department respectfully disagrees. This program is an important piece of the focused investment into the Purple Line corridor to support the state's transit investment and benefit the capital region. The facade program strengthens small businesses and commercial corridors by improving storefront conditions, attracting private investment, and reinforcing local economic vitality. The allocation for the facade program is necessary to meet local community goals and strengthen the corridor to benefit Montgomery County and the region and the entire state. To briefly address the request for clarification on Just Communities prioritization, each program must take a distinct approach to prioritizing funding, reflecting the complexity of its structure. From grant making to lending, the way investments are prioritized varies across programs. Our written testimony provides a detailed explanation of how prioritization works across each of the department's programs. And with respect to staffing, the department continues to manage positions carefully. Vacancies are maintained only where aligned with specific operational needs and funding sources. DHCD does not carry excess capacity and continues to align staffing with workload, statutory responsibility, and fiscal constraints. The FY27 allowance maintains fiscal responsibility, balances fund types, and deploys resources where they generate measurable community return. I would like to thank the Department of Legislative Services, specifically Emily Haskell, and our partners at DBM for their continued engagement and thorough review of the department's budget. And responses to outstanding questions and recommendations have been provided through our written testimony. And with that, I'm happy to take any questions.
Thank you, Madam Deputy Secretary. First, a little disappointed, my guy, Secretary Day is not here. I wanted to ask some hard questions, and it is tough because we're friends. But in reference to, and I'll lean in a little bit, so Bernie, Ned, these are legislative initiatives. Like, these came from the brain trust of the legislature. But this year, I believe that the agency took a little bit more from a partnership standpoint. It doesn't always feel like the partnership exists. If you could comment on that a little bit around those two specific programs.
Sure, and thank you, Mr. Chair. I think you're referring to our pre-awarding in this year's budget. So the intent behind pre-awarding for our state revitalization programs was really to ensure certainty for those projects. We awarded in the FY27 budget $74 million worth of projects, equaling 185 projects across the state and across those 6 revitalization programs. And, we wanted to ensure that they knew that dollars were coming to them, so they could leverage that for additional private dollars. But the goal here is to ensure that we're funding the highest and best use dollars to the best projects that are going to be developed and built as quickly as possible. So just so everyone's aware, all of our state revitalization programs are rigorously scored through a multi-agency collaboration review process that goes a couple weeks, more than that. But so again, just going back, it's to ensure that we're awarding projects that are going to make it through the project development process and get shovels in the ground, projects built. So I think we've got a good solution that's more in line with the goals that we both have to ensuring projects are selected and get built.
I'm gonna make a comment. I don't think that it's the best solution, to be honest with you. I think that in my 12 sessions, this is my 12th session, I think that there's always been some level of partnership in reference to the executive branch and the legislative branch, and this was an extreme measure. First time that's ever been done in this form, and I think that, I hope that we'll get back to a better practice that makes sure that we're in alignment from a legislative branch and the executive branch, and I'll leave it right there. I try my best to read as much of the public testimony. There are a number of folks that are doing public testimony after you finish. And if you can comment on the school rental assistance program, there are a number of organizations that do not feel as though it's adequately funded at this point as introduced, and if you could touch on the agency's perspective of that, that would be helpful.
Sure. Well, with me is Assistant Secretary Danielle Meister, who designed and administered the program. But the main takeaway is I think we agree that more funding certainly is needed. It was $5 million in FY25 and FY26. We combined both pots of funding to do around this year, and Danielle can speak to the specifics of the need, but the demand outpaced what we had to fund. So Danielle, do you?
Sure. I think, anytime we open a rental assistance program, we know the demand will be high, but even this program, I think, shocked us. Over the course of 8 weeks, we only operated the program in 8 counties, so it was not statewide. But in that 8 weeks, we received over $31 million worth of requests. For only $10 million we were able to give out. So, looking at fiscal year 27 and a $5 million budget, that does mean that at current, if it's not increased, we'll have to reduce the scope of the program, either through number of households served or maybe less jurisdictions. So the demand was significant, and again, only in 8 weeks. It was really targeted outreach to community schools families, so I think there's some really great learnings we had, and that's in our DLS analysis about how to best reach families. We reached a population that we normally don't see access the homeless system, which was really powerful. So I think, our really great outreach and marketing to schools certainly boosted those numbers, but overall there's just a really crushing and desperate need for economic support for families who are on the lowest margins. And one of the things we note in our report as well is that the vast majority of families were under 50% of the area median income that ended up being served, but even more so we're on the 30% under side of that equation.
So it sounds like you all are well aware of the need. You said that there was $31 million in requests. You talked about the $10 million being scaled down to in FY27 to $5 million, so it's split in half, even though the need probably is either starting to scale or at least be at $31 million. Can you speak to ideas that you all have been proposing or brainstorming in reference to trying to figure out how more funding funds this program to fit the need?
Sure. Well, I think we're trying to address it in some of our legislative proposals this year in creating more opportunity on the production side of housing. We know that by having more supply, we're going to bring costs down. But again, at the basis, we know we need more dollars, and that's tough to do this year in the economic climate that we're in. So I think, we'd love to partner and brainstorm around that with you all.
I appreciate you recognizing the partnership. The second one was securing older adult resources, SOAR. A number of organizations testified on the importance of this program. If you can speak to it, whether it made it in the FY27 budget or if it's been funded at what it was in FY26 or if it needs to scale.
To my knowledge, it's not a program that's funded under DHCD at present. So the Maryland Housing Counseling Fund is an eligible source, but it's a competitive funding application every year.
Is it any specific reason why it wasn't funded in FY27? Is the need still the same or?
The project didn't meet threshold requirements for 2 years in a row. So we would need to see those addressed.
Got it. Senator Zucker.
Thank you very much, Mr. Chairman. I may have missed it, so I apologize if I did. There were 5 grantees that received legislative additions last year. Have you all reached out to them again just to make sure that they're utilizing the money? Looks like Humanum, iHomes.
Phoning a friend.
No problem, and it's on page 6, so I'm not kind of going off of, I'm not talking about something that's not in front of us. Oh, okay, you know what? We'll talk offline.
We can get back to
We'll
you.
talk
Yeah,
offline,
sorry.
no problem.
Yep. Okay.
Seeing no further questions, Madam Deputy Secretary, we have a number of folks that are going to do public testimony, so if you could just hang around for that. And at this time, I get the opportunity to call up one of our phenomenal partners, Ms. Ellen Burke, my friend Matt Hill, these are all my friends, matter of fact, Ellie Mitchell, and Angela Martin.
I'll start. Good afternoon, Chair McCray and members of the Budget Subcommittee. My name is Ellen Burke, and I serve as the Executive Director of City Life Community Builders in East Baltimore. I am here to urge you to support the Department of Housing and Community Development's FY27 budget. City Life Community Builders is proud to be a selected awardee in the FY27 State Revitalization Program. For more than 3 decades, we have worked in East Baltimore to transform vacant and distressed properties into stable, affordable homeownership opportunities that anchor families and rebuild neighborhoods. Most recently, we have rehabbed more than 65 homes in some of the most disinvested blocks in East Baltimore, achieving whole block impact. These are not isolated projects. They are strategic interventions that remove vacancy and blight, increase public safety, stabilize property values, expand affordable home ownership, and protect generational wealth for low and moderate income families. We pair redevelopment with workforce opportunity by training local residents in construction trades and hiring local contractors, ensuring that state dollars circulate within the very communities Bernie funds are designed to strengthen. Now we are expanding that impact through an MOU with Morgan State University and the Johns Hopkins University Whiting School of Engineering. We are launching the Artificial Intelligence and Machine Manufacturing Workforce Development Academy. This initiative will train more than 400 local residents annually in AI-driven manufacturing, advanced 3D printing, and autonomous systems, supported by a dedicated community makerspace. This is what equitable innovation looks like, connecting historically disinvested neighborhoods to the high-growth economy of the future. Operating support is the backbone that makes this measurable neighborhood transformation possible. Without it, capital projects stall, partnerships weaken, and momentum is lost. Thank you.
Mr. Chair, members of the committee, my name is Matt Hill. I'm an attorney at the Public Justice Center, which is a member of Renters United Maryland. I'm here to testify in support of the department's budget with the addition that we are seeking significantly more funding for the community school rental assistance program. First, I just want to thank the department for their work on this program. Just launched this last year, and it's been a very collaborative process. They've engaged advocates around the state in trying to come up with the most efficient, low-barrier program that's still very targeted to families with children in community schools who need these funds the most to prevent an eviction. Second, I want to note that homelessness, and I think this is in the department DLS report, is up 53% since 2021. And while we appreciate the focus on building more housing, families need relief now. And this program is, again, very well targeted to make sure that that inevitable speed bump in their finances does not become a catalyst for homelessness. It is the only dedicated eviction prevention funds in the state. It's not part, as I understand it, of the community schools program in the sense that there are other housing supports in community schools. I don't believe there are. And so it fills a very unique and important gap in the current social safety net that, again, directly prevents homelessness. Third, I just want to point out that it also leverages the state's investment in the eviction right to counsel. So I had one client, Shantice, who has children in a community school in Baltimore City, and her partner was laid off due to the Trump administration's policies. Her disability benefits were temporarily suspended, and so she found me in rent court one day. And because we were able to provide services, we were able to connect her to the community schools rental assistance program, work with the landlord to get a rodent infestation fixed, make sure he was going to accept those funds, and make sure that she was going to be able to benefit from that program. So thank you for your time.
Good morning. Oh, good afternoon. Geez, I don't know where my brain is. Good afternoon, Chair McCray and members of the committee. My name is Ellie Mitchell, and I'm with the Maryland Out of School Time Network, and we have the privilege of serving as the backbone for the Maryland Coalition for Community Schools. And one of the main reasons community schools were included in the blueprint was simple. Poverty creates barriers to learning, and housing instability is one of the greatest challenges a family can face. It is incredibly hard for a child to focus in school, do homework, or feel safe in the classroom when they don't know if they have a roof over their head when the bell rings. And that's why the Community Schools Rental Assistance Program matters. It aligns with Maryland Community School strategy because it reaches the families most in need, and community school coordinators are uniquely positioned to connect those families not only to rent support, but to other wraparound services that stabilize the whole household. The pilot opened in 8 counties, and as you've heard, demand far outstripped funding. But I want to share a few stories of the impact on those fortunate enough to benefit. In Wacomico County, a mother and 2 children lost housing after experiencing domestic violence. With the Community School Rental Assistance Program support, she was able to move into a new home over Christmas break. In Montgomery County, a single mom avoided eviction long enough to find a new job so her children could stay housed, stay in their school, and begin rebuilding stability. And one parent, helped through the United Way, said, "This assistance will lift a huge weight off of my shoulders." The United Way is also helping families that are navigating mental health crises and caring for children with special needs, challenges that also compound housing insecurity. This program is helping reduce chronic absenteeism. It's helping to reduce student mobility. And so if we are serious about ending childhood poverty, this program is a critical leverage point. $5 million isn't enough. $25 million isn't enough. However, it's the kind of investment that can snowball by preventing homelessness before it happens. Thank you.
Good afternoon, Chair McCray and subcommittee members. My name is Angela Martin. I'm the Executive Director for Maryland Community Action Partnership. We represent the 17 community action agencies that work hard to make sure vulnerable families can achieve economic security. In essence, community action agencies are emergency human service providers. We know not every emergency requires a siren. Some require eviction prevention, and emergency shelter, affordable housing, weatherization, or rapid rehousing. When a family receives an eviction notice, or when a senior faces freezing weather and has inadequately insulated homes, or when a parent loses a job and risks losing stable housing, community action agencies are often the first one that is called. We stabilize families before short-term hardships become long-term crisis. In 2024 alone, we served more than 286,000 families. Agencies prevented 7,200 evictions and provided emergency housing to over 8,300 individuals. We operate emergency shelters, support rapid rehousing efforts, develop and manage affordable housing, and provide weatherization to reduce energy costs. And we know how important that is right now. We value our partnership with DHCD and appreciate the department's continued leadership in housing stability. We also appreciate this committee and the Maryland General Assembly for establishing the $250,000 state investment in the Maryland Community Action Agencies, Community Action Fund. The department's partnership in implementing this is an important commitment. It is the first step in strengthening this infrastructure called community action agencies. This funding goes directly to community action agencies to strengthen frontline capacity and to ensure families are safe, stable, and out of crisis. So we support DHCD's budget. Thank you.
Thank you. And seeing no questions, I just want to lean in and say, like I said, you all are the ones that I always call when I need some level of assistance and trying to figure out tough problems for constituents. So I just want to say, just not thank you just for your advocacy on this specific issues, but more importantly, just thank you for what you do for folks across the state of Maryland. Colleagues, we're going to call up the next group of public testimony. That is Chris Gillis, Kevin Lindemood, Sarah Price, and Nancy Hafford. And please begin.
Good afternoon. My name is Chris Gillis, and I'm testifying on behalf of MHP, a nonprofit affordable housing and community development organization serving Montgomery and Prince George's counties. I'm here today to convey our support of the governor's proposed budget for the Maryland Main Street program. MHP administers the Long Branch Main Street program in the Silver Spring area of Montgomery County. The Long Branch Main Street was designated by DHCD only a few weeks ago. MHP has engaged in neighborhood revitalization and economic development efforts in the Long Branch neighborhood for the last 15 years. And the Main Street designation will enable us to pursue tangible economic development opportunities for our community. For those of you who may not be familiar with Long Branch, it's located along the Purple Line and will have 3 station stops. One of our top goals is to leverage the economic development potential of the Purple Line and translate it into economic growth for our business community. We are currently hiring for our first Main Street manager for the business district. Among other things, the resources provided by the state will enable us to hire a full-time manager for the business district who will be squarely focused on improving the health of existing businesses and helping new businesses in their journey from startup to success. I also want to shout out the staff at DHCD who go above and beyond every day to support Maryland Main Streets and push us to do more every day. The state's investment in Main Streets like the one in Long Branch is returned many times over to the state in the form of additional sales tax revenues and increased property assessments. Our facade and physical improvements we undertake increase property values, and the small businesses we support often comment that their biggest sales days of the year occur around large community events that we organize, which brings thousands of people to the neighborhood. Please support the governor's budget, and thanks for your time and consideration today.
Good afternoon. Good to see you, Mr. Chair, members of the committee. My name is Kevin Lindemood. I'm the president and CEO of Healthcare for the Homeless. We're Maryland's leading provider of integrated health services and supportive housing for people experiencing homelessness. We served 11,500 different people last year at clinic sites in Baltimore City and Baltimore County through a mobile clinic and a street medicine team on the streets. We also supported 800 people in permanent supportive housing. We're here in very strong support of the DHCD budget and of Secretary Jake Day and his leadership team. Healthcare for the Homeless has long understood that homelessness is fundamentally a housing problem. The Federal Government Accountability Office has found that for every $100 increase in median rent in a community, homelessness increases by 9%. We also understand that housing is healthcare. Every single clinical intervention we provide is made so much better and more effective if rooted in permanent housing. As Secretary Day has said, if you want to end homelessness, you start with housing. And the department has very much actualized that by establishing the Office of Homeless Solutions around the executive team table and by enshrining in the QAP, the Rules for the Low-Income Housing Tax Credit Program, a set aside for the inclusion of permanent supportive housing to ensure that a limited number of projects reach all Marylanders, including those experiencing homelessness, by establishing a homelessness preference across all competitive LIHTC applications, and by increasing baseline services for operating expenses, which are so instrumental to providing the services people need to stay housed. 3 years ago, we established HCH Real Estate Company, a wholly owned subsidiary, to build housing. We could not do that work without DHCD's support, and thank you for the opportunity to testify.
Good afternoon, Mr. Chair and Senator Zucker. Sarah Price here on behalf of the Maryland Retailers Alliance in support of the mission of the Main Street Maryland program. Main Street Maryland preserves local historic and cultural resources throughout the state while supporting small businesses and promoting new investment and development. The communities in the Main Street Maryland program have access for project funding from the Main Street Improvement Program, which is a line item in DHCD's budget as issued by the governor and approved by yourselves. The grant provides much needed financial support, which the Main Streets can use for a variety of purposes, including but not limited to staff salary support, operating funding, strategic planning projects, public art installations, enhanced seasonal decorations, business recruitment and retention programs, and even leveraging the money for other grants that require matching dollars. The Main Street Improvement Program has been level funded at $1 million for the upcoming fiscal year, and this allows DHCD to provide the grants to the Main Streets without a competitive application process. I completely understand the budgetary constraints that are facing the state, but I would just note that I think the program would always love to see additional funding so that more communities can participate in the program. It was restructured to add additional tiers in 2025 to expand to new communities. And right now, I believe 22 out of 23 counties in the state do have communities that are participating in the program. And then Baltimore City maintains its own Main Streets. These the dollars coming from the state allow the Main Street operating offices to multiply their impact and ensure that the downtown communities can continue to serve as an anchor for their communities as a whole. And it is imperative that these funds be protected. So we ask that they please be maintained in the final budget. Thank you.
And want to say thank you. In seeing no questions from my colleagues, at this time, I didn't hear Nancy Hafford, so if she is in the room, could she please come up? Stephanie Prostel, Catherine Lark, Callie Schumitz, and Kendra McAbee.
Good afternoon, Chair McCray and members of the subcommittee. Thank you for the opportunity to speak today. My name is Susan Hartman, and my colleague Kendra Maccabee signed me up. So I wanted to make that clear. I serve as the executive director of the College Park City University Partnership, a community development nonprofit jointly supported by the City of College Park and the University of Maryland College Park. On behalf of our organization, I am here to urge your support for the full passage of the Department of Housing and Community Development's FY27 operating budget. DHCD's support has been essential to the success of the partnership's homebuyer assistance programs, including the Live Work College Park Down Payment Assistance Program, which has facilitated over $32 million in home sales in College Park, and the College Park Community Preservation Trust, Maryland Affordable Housing Land Trust, which creates permanently affordable homeownership opportunities in a city poised to experience significant increased housing market costs with the arrival of the Purple Line. Our programs are designed to encourage residents to live where they work, strengthening neighborhoods while helping to attract and retain talent in College Park. College Park is a Maryland sustainable community and a community legacy community. Maintaining the support is critical to the long-term economic prosperity of our community, particularly at a time when many Marylanders are considering leaving the state due to housing affordability challenges. With this support, we've been able to provide access to home ownership in an increasingly high-cost area, strengthen neighborhood stability, and support College Park's broader sustainability goals through reducing vehicle miles traveled and supporting residents to live close to their places of employment. We also recognize that when Marylanders leave due to unaffordable and unattainable housing, we lose innovators, problem solvers, and creators who deliver excellence and economic growth at institutions such as the University of Maryland and in the Discovery District, Maryland's capital of quantum, which is located in College Park and our neighbor Riverdale Park. Funding support from DHCD enables us to contribute to strengthening the state's economic development goals. Without continued operating support, we cannot move these projects forward in the next fiscal year. Thank you very much for your time.
Good afternoon. My name is Stephanie Prestel. I'm the Executive Director for Housing Initiative Partnership. Housing is HIP. We are a nonprofit affordable housing developer and counseling agency. We develop innovative affordable housing, we revitalize neighborhoods, and we equip people to achieve their housing and financial goals. Our vision is that every person lives in high-quality affordable housing in a thriving community. We're in both Prince George's and Montgomery County, and during our 36 years of service to our communities, HIP has served 40,000 clients and developed over 600 units of affordable rental housing and developed 120 units for first-time home buyers. I wanted to touch on two items. One is operating support for nonprofit organizations. The Housing Department has been very generous in supporting organizations like HIP with capital funds, but where we are struggling is with operating dollars. And two programs that you're very familiar with, NED and Bernie, have a small amount of operating dollars attached to them. The de minimis rate at the federal level is 15%, and we're at 1%. This last year has really taken a toll on nonprofits working at the local level, especially community development corporations. We are the front line for community development, implementing new models and scaling up impact. We are the local economic first responders and the drivers of social progress. The costs for staff, supplies, rent, IT, robust financial systems, and insurance have risen substantially, and it's more and more challenging for organizations like HIP to have the funds that we need to actually implement the capital resources effectively. So we encourage you to continue to think about the operating support that our nonprofits so desperately need. And the second piece that I will just say ditto to my colleagues, the Community Schools Rental Assistance Program has been a tremendous resource in our communities. HIP was honored to be one of the administrators of that program in Prince George's and Montgomery County, and we really urge you to continue to find ways to support it. Thank you.
Thank you, Chair McCray, members of the committee. My name is Callie Shumitz. I'm with the Maryland Center on Economic Policy. We here in support of the DHCD budget, but joining others in asking for additional funding for the Community Schools Rental Assistance Program. Outside of the very insufficient Federal Housing Choice Voucher Program, there's very little funding available that directly helps families afford housing. So while we agree that expanding housing supply is an important long-term strategy, it does nothing to help families in need today. As you've heard from others, the Community Schools Rental Assistance Program has been extremely effective and impactful for the families who receive it. These are families who are living on the edge of affordability, where a temporary job loss or unexpected health issue can leave families at risk of eviction and homelessness. However, with only $5 million in the budget, that means only a fraction of the families in need will receive assistance. Protecting children and their families from experiencing a destabilizing eviction also saves the state money in the long run. So a 2023 study on eviction prevention funds in Maryland found that every dollar we spend on eviction prevention yields $2.39 in reduced expenses for other services like emergency shelter, healthcare, foster care. And it also boosts our economy by promoting increased employment and income stability, which is easier for people to have a job and keep their jobs if they are stably housed. So expanding the Community Schools Rental Assistance Program will help meet the needs in the communities that have already have the programs up and running, and potentially allow DHCD to expand the program to serve other areas. Thank you.
And thank you. Seeing no questions from my colleagues, we'll keep moving through the public testimony. I'm going to call once again Catherine Lark, Ashley Wallace, Shauna Diaz, Meredith Chaikin, Kyle Long, Marceline White, Jennifer Bevendangle. Since it's moving a little bit slow, I'm also going to call up Jamila Blake, Tania Chestnut, and that's it.
Good afternoon, Chair McCray, Senator Zucker. For the record, my name is Marceline White. I'm the Executive Director of Economic Action Maryland Fund. I'm happy to be here today, and we're here in strong support of DHCD's budget, and we are also respectfully requesting $225,000 in funding to support our Securing Older Adult Resources Program, SOAR. I'm just going to take the 10,000-foot view and tell you a little bit about SOAR. We keep people housed by focusing on older adults and low-income renters and families with disabilities. And we do this by providing support for the homeowners and the renter's tax credit. We're the only organization in the state that screens for the renter's tax credit. And we focus on high-touch, high-needs older adults and families who need support gathering their documents, uploading things to the portal. We advertise, screen, support, and do follow-up with SSTAT to make sure every person who comes through our door receives the credit or we resubmit the information. Since 2019, we have returned more than $6,700,000 to low-income older adults and low-income renters across the state. We are asking for support now in this time, particularly not only to keep people housed and allow our older adults to age in place, but with the changes in Medicaid and SNAP. We did a survey in December 2025, and 60% of our clients who we surveyed were worried about being able to meet the Medicaid and SNAP eligibility requirements. And many of them referenced digital equity issues, lack of access to broadband, and difficulties accessing and uploading documents to the portal. So this additional funding will allow us to train and reach out to all of our clients, as well as expand to other clients around the state to make sure that people are not falling off of the Medicaid and SNAP rolls. It also allows us to expand our footprint. We served 900 people last year, the majority in Baltimore City, Baltimore County, but we do have a footprint across every county of the state. And for these reasons, we urge your support of this appropriation. Thank you.
Good afternoon, members of the Budget and Taxation Committee. My name is Jamila Blake, and I'm a social worker who's a SOAR counselor with Economic Action Maryland Fund. SOAR stands for Securing Older Adults with Resources. SOAR provides case management services to older adults in their home, at their local senior center, library, local cash campaign site, St. Mary's Outreach Center Hamden site, Community Action Partnership Northwest site, or by phone. For a moment, I want the committee to imagine they are 71 years old and a widower. Your only monthly income is your Social Security of $1,010 a month. Each month, you pay $710 a month in your mortgage, $200 a month to BG&E, and $100 to the City of Baltimore for water. After paying all of your bills, you only have $90 a month to live on. You don't own a car because you can't afford the insurance and maintenance. Your furnace just stopped working and you can't afford to get it repaired, so you're using space heaters to keep warm. You buy most of your food from the nearest Family Dollar because that's all you can afford. You don't know how you're going to pay your upcoming ground rent or property tax bill. These are the many heartbreaking stories I hear daily from our older adults. Last year, SOAR provided 400 homeowners and 433 renters with assistance. The average homeowner and renter we serve, their income is under $30,000 a year. Screening totaled $910,638 in anticipated credits for renters and homeowners. For every $1 invested in the SOAR program, $4.16 is returned to older adults in the form of critical benefits. As more and more people age in Maryland, SOAR will be needed. I urge this committee to fund SOAR so we can continue to provide resourceful services to our older adults in Maryland.
Good afternoon, Senators. My name is Jennifer Bevan-Dangle. I'm the Deputy Director of Economic Action Maryland Fund. I'm just here to help answer any questions. We support the DHC budget. We also support additional funding for the Community Schools Rental Assistance Program. And of course, we are asking for your assistance with our budget request. You do have witness statements from our two witnesses. They joined us in the House, but we knew the snow today would make things dicey for them. So I just want to draw your attention to Ms. Colick and Ms. Moore's testimony, which is on the record, as well as our sign-on letter, which is under my name in the file. To answer the chair's question earlier, our state funding 2 years ago was actually through the comptroller's budget because we do so much work with SDET because that's where these tax credits live. So that's why it wasn't under DHCD before. We sort of looked at the budget where we help older adults, we could be under aging. We feel at its core this is a housing service, so we could be under DHCD. We are very agnostic as to where in your infinite wisdom you think is the best fit for this program, but we do ask that you continue your support because it is so critical.
So, Madam Director, in reference to did y'all hit y'all targets?
Yeah, we actually have exceeded our targets in Baltimore City and Baltimore County, where we also work with the city and with Baltimore County in terms of setting some targets and deliverables. We did see increased demand in addition to the 900 people that we serve directly through the screening. We've seen a 50% uptick in people using the website and downloading documents from the website. And we've also seen an increased demand in calls to our hotline, which Jamila responds to as well.
Were there previous conversations with the agency in reference to, obviously you said it was in the comptroller's budget and now you would like it in DHCD or older adults? Help me understand what that conversation sounded like.
I believe that, well, I actually asked the Deputy Director, I believe we've had conversations with the Secretary of the Budget who thought this might be a good fit for it. But again, it was under the Comptroller's budget in 2024. We did not seek funding last year. We would ask for funding this year with the increased demand and the changes in terms of SNAP and Medicaid. So we're agnostic about where it goes, but it fundamentally is about keeping people housed.
First, I also want to just say thank you for your leadership, the organization as a whole. You are one of those partners that I consistently reach out to when I have constituent issues, so just wanted to say that again. Before we close out this agency hearing, I do want to ask the question to the public. Is there anyone that signed up to do public testimony but did not hear their name called? Ms. Claudia? Please.
Good afternoon. My name is Claudia Wilson-Randall. I'm the Executive Director of the Community Development Network of Maryland. Happy to be here. Thank you, Chair McCray, for recognizing and calling my name. I did submit written testimony, didn't know if I could be here today to speak, but I would just like to thank all of my colleagues who are here today and are members of the the Community Development Network. What they all have in common is economic vitality for the state of Maryland, and the need for economic development statewide is, you know it, And the folks at the Department of Housing and Community Development, I strongly support their operating budget. I did submit testimony favorable with amendments because I would like to see increases in operating support. We did a survey of partners this summer, about 80 responses, organizations across the state. They all talked about the need for operating support. They cannot move capital projects without additional operating support. So I'd love to see that increase and be 10% of the Bernie and NED awards, that there be 10% for operating funds. I also would like to stress the need for additional rental assistance. The Community Schools Program has been an excellent program, and I'd really like to see it funded to a higher level. And I think finally, I would just like to say that we are a state with a lot of power. We are the third wealthiest state in the country. When I'm with my colleagues from throughout the country, they talk about how, well, what a great shining example Maryland is. We can do more. We have resources. I read the paper. I know the budget problems, but we need to invest because what everyone needs is a growing economy in the state of Maryland. So thank you so much.
Any questions?
Good afternoon, Chair McCray and Senator Zucker. My name is Richard Green, and I'm here representing the Maryland Mortgage Bankers and Brokers Association. Our members include banks, community banks, credit unions, and mortgage banking companies. We essentially partner with DHCD, the Maryland Purchase Program, to afford opportunity for low to moderate income buyers to obtain mortgage financing that they can sustain. The fact is that the rates are extremely competitive, and they provide down payment assistance, which would not otherwise allow people to obtain home ownership and start building generational wealth. The program is further supports initiatives to include Smart Buy, which is a student debt reduction program. The key is affordability at a time when it just doesn't really exist well in the state of Maryland. Other initiatives include funding for rental programs and housing, affordable housing communities. And we are in a time when crisis is all over with housing. So the Maryland Mortgage Bankers and Brokers clearly support this initiative, and we continue to want to create housing opportunities that people can afford in Maryland. Can't do it without the MPP. Thank you.
Colleagues, seeing no further questions, just want to lean in and say thank you to everybody that gave public testimony. Thank you for your advocacy. To the agency, just want to say look forward to our return measure of partnership. Can't wait to see my guy. And Ms. Haskell, just thank you as always in reference to helping us see it, the strengths and the weaknesses of the respective agency. Thank you. Colleagues, this ends and adjourns the meeting for Health and Human Services.
Thank you.